Hi, everybody. Welcome back to Empowering Native Wellness. My name is Kamaile, and I am the Outreach Multimedia Coordinator in the Marketing Department. And today we have another guest who has actually been on the podcast before. You were here almost exactly 1 year ago for this pretty much exact same topic.
Yep.
So Jirrah, do you want to introduce yourself?
Sure. Hi, my name is Jirrah Bautista. I am the program coordinator for the Peace Between Partners program here at Indian Health Council. And Peace Between Partners, the program provides services to individuals who have suffered or have victimized by domestic violence and sexual assault.
Awesome. And so last year when you were on the podcast, you were very new.
Yes.
Like a month in new,
Yeah.
right? So what kind of stuff changed since last year? Just adapted and yeah.
Since last year, I'd say more like cultural awareness, a lot of more training in how to provide services to this community specifically. I've definitely learned a lot in that area and met a lot of people, met a lot of advocates who work in the same field, who have been doing this for a long time, and about the ins and outs and the kind of, I guess, awareness that still needs to be brought up in the community and how I can do that through my office. But yeah, and definitely more comfortable compared to last year when I was fresh and new, still excited and still very passionate about it. And I'm been seeing a lot of, I guess I'm able to see how I have helped the community and the individuals that come through the office. And so that's definitely a big and good positive change since last year when I was a month in.
Yeah, that sounds like a lot of amazing, adaptations and a lot of things that you've learned. And I know you've also kind of started bringing more services and more groups. Would you want to tell us a little bit more about that too?
Oh, yeah. So at first, we had a women's empowerment circle that came in that was being offered not like on a monthly basis. I think they were meeting a few times a month. And so we've increased that since last year. We meet pretty much twice weekly. We meet Wednesdays and Thursdays, once a week here at Rincon and once a week at Santa Isabel. And since then, we've added an adult, non-gender specific empowerment circles. So that's pretty new, but we did want to make it more inclusive and not make other genders feel excluded from the services at our office. So that's definitely exciting. So we've had one which was kicked off by a self-defense jiu-jitsu instructor, and so that was very exciting. We had some ladies come in, some members of the community come in and see that what it means to be ready in case you're attacked, in case you're in a position of vulnerability. And so that's definitely something that people in the community can benefit from, whether you're a male, female, two-spirit, young or old, with a group or by yourself. Something that we all should be aware about, because you just never know this day and age.
I think that's really important that you guys did add a new group that isn't just specific to women, because I know one of the things that we talked about on the last podcast was domestic violence can be experienced by anybody, and domestic violence can be by anybody. And so I think that's really awesome that you guys introduce something like that for everybody too.
Perpetrators can be men or women, young and old. I mean, there's so much the issue of violence does it rings through different circumstances at the home, at the school, at work, and anybody and everybody can be affected by it, and can be, you may not even know that you're a perpetrator or that you're doing it. And so just because of the lines of what is and what isn't can be blurred sometimes. It's not a straight, like, a punch in the face. It's verbally abusing somebody, bullying somebody, belittling somebody, making somebody feel bad, emotional, financial. There's such a range. And so, yeah, anybody can do it, and anybody can be a victim of it. And so we want to make sure that people are aware and are empowered. And so that's what we want to kind of provide through our office.
Yeah, you guys do a really good job, and I know that your name is out there a lot, and I think that's also very important to the services that you provide. I know you said that domestic violence can be a range of things. So what is the difference between domestic violence and sexual assault?
So domestic violence, actually, it was termed family violence before, where like I think the basic what would come out of what would get reported to the police would be something that happened between a mother and father or people in the same family. But with changes in family dynamics, step siblings and step parents and extended family members living in the same household, it's changed to domestic violence. So that happens in the household, and it can be with anybody in there, an uncle, grandfather, auntie, cousins, just people who are living together, or somebody who you have an intimate partner with. So intimate partner violence is also part of that definition, and it's abuse, it's verbal, it's financial, intellectual. So making somebody feel bad. It's just a pattern of behaviors that use kind of that power over somebody else, to make them do what you want them to do or make them feel like they cannot escape that relationship. So it's really like more of a power struggle. And sexual assault involves more sexually driven actions, harassing somebody by showing them sexual pictures, using sexual terms that are inappropriate, and then an actual assault or penetration. So that's where sexual and domestic violence kind of differ. So sexual assault is more sexually oriented of an assault on somebody.
Right. And I think with sexual assault, one of the biggest conversations that is being had right now is teen relationships. And how does a teen, somebody who's just getting into dating, or even somebody who's kind of gone through their whole life only knowing an abusive relationship, how does somebody like that be able to decide what is a healthy relationship? And what are you guys doing to get those words out there and that education out there?
That's really important, really good topic of discussion too, because there's prevention, there's awareness, and there's being educated, and then being empowered to know that you can say no. So one of the things that we do provide is a healthy relationship kind of workshop or presentation to the younger adults. So between I think 14 to 25 is our age range that we focus on for this specific topic and workshop. Excuse me. But yeah, it does focus more on prevention and being aware of what a healthy relationship looks like, what it means to you, kind of honing in on your values as an individual, as a person within a relationship, and knowing that there's ways to kind of speak your mind and be strong, be brave and courageous about what it is that you want and what you don't want, and communicating that with your partner, recognizing when somebody is kind of when the relationship starts to shift into something that's more one-sided, where the other partner has more control, or is starting to gain more control over the relationship. For example, a couple who used to have two sets of friends, now just has one partner's friends, and they only spend time with that partner's friends and do what that partner wants to do. And then again, just like in other domestic violence relationships, it can be a cycle where it's brought up, it's discussed, maybe even fought about, and then one partner says, I'm sorry, apologizes, changes, but then goes back to doing it again. So it can be a cycle, but the key is knowing and teaching the younger adults that it's okay to say no, it's okay to leave relationships that you're not comfortable with, that you don't want to be in, that are not healthy. So part of the curriculum is to teach them what is a healthy relationship, because they may not know that.
Yeah.
Right. We're not always taught that, especially at home. It's not, like a presentation that your mom and dad give you.
Yeah.
It's something that is modeled usually, whether it's there in the home or outside or on TV even. And so there's just so many influences, right?
Yeah.
But we try to teach that, and it's a native-based kind of perspective, what is valued, and giving that individual the power to recognize and say what they want and communicate that. And then we teach what is kind of in between an unhealthy relationship, lack of trust, and kind of swaying towards one side or the other, isolation, and maybe outbursts. And then what is an abusive relationship, where somebody is verbally being abusive to the other person, maybe even physically, like taking their phone away, and just a total mistrust and lack of respect for the other person. And so that's what we try to teach, because that is kind of like the foundation and what leads to something that's more violent, and for both sides of the relationship. For somebody who may be leaning towards abusing their power over the other person, it's good to recognize that early on also, so they can start making those changes, and then be more open to that discussion and the conversation when it comes up within that relationship. Because that, if you've been doing it for so long and you have partners who've been okay with it and never made an issue about it, when you get older and it becomes a norm for that person, and so it's harder and can be more volatile when it comes up and it's brought to their face. Like, no, I'm not like that. Well, you've had years, but nobody has really taught or told you about it, and so hearing it for the first time later in life, it's more difficult to accept and change. So it's definitely important to have that discussion early on. When we do this with our 18 and under crowd, we do ask for parents' permission. And so we'll have, when we have these workshops, we'll have parents' permissions for these discussions to be had with the younger crowd. Because it can be difficult for them, and maybe even traumatic if they have that going on in their life. But we want the parents to know that it's, that they will be giving permission. And it's funny you brought this up. We do have something coming up at the end of the month. It's for our kind of a new kind of circle too, like our women's empowerment circle. It's a youth empowerment circle. And the kickoff will be on the 30th of October. And it is a self-defense class open to youth 14 to 25. We're partnering up with Break Cycle Warriors. So they will be providing the instruction on self-defense. And it'll take place at Paula Housing Resource Center. So we're partnering up with Paula's Youth Empowerment Initiative. That's their program over there.
With Maria.
With Maria, yes. And so you can contact our office to find out more information about that. But that's going to be something we're excited about, because it'll involve the youth, and it's something that the instructor is really fun, and he's really good at what he does. So he'll incorporate some healthy relationship topics and the importance of it, and the empowerment, of course, aspect of it will be part of his talk and his discussion. And so he was the instructor who provided the self-defense for our adult empowerment circle kickoff date. So
when you say he, is that Bradley?
I'm sorry, yes.
Okay. Okay, just want to make sure.
Bradley at Break Cycle Warriors. Yeah,
okay.
So he's really good.
Yeah, no, he's been very active in the community, and I know a lot of people really enjoy the stuff that he can provide for the kids. And with the kids, I think it's really great that you are doing what you're doing with having a youth curriculum. Last year, we went out on an outreach trail with all the schools and all the ed centers, and you were able to talk about healthy relationships with teens. How much do you feel like talking to the youth really helps with generational trauma? Do you feel like that's really the place where we need to start, is with the youth?
I can't say how much it would really help. I think it's still a topic to be had. I don't think that it occurs as naturally within, that atmosphere, that environment where it should maybe in the home.
Mm-hmm.
I know from my I'm Filipino, and so my culture, it occurs also, and I think my generation were able to talk about it and kind of laugh at it and make it a little more comfortable topic.
Yeah.
But coming from, like, say, at this kind of like as a professional coming into a home and talking about it may not be something that's like I don't know how effective that'll be.
Mm-hmm.
But I think teaching the kids that it is okay to talk about, teaching anybody in the community, actually, that's from the adult level. We teach that it's okay to talk about it, is that, that how are you going to get help if you don't ask for it, and how do you know if you need help if you don't recognize it? So as on an individual level, yeah, it is important to know that it's okay to talk about. But for like a structured environment, it's really difficult. Not everybody wants to come out and say that it's happening. So I think just broadly, in general, being comfortable with a topic, and then learning how you can bring it up. Like, subtle things like wearing purple, for example. Constantly wearing purple, like purple is as a show of support for domestic violence survivors, and so just I think that in itself, wearing a purple ribbon, or that kind of attending events, and then you're able to share your experience with others who are willing to listen to it. That's important, and then you feel more comfortable in sharing more personal thoughts and opinions on it. And then, I think for me, especially here, it would be good for a person who has gone through that experience in the community to share it and maybe talk about it and what worked for them, what didn't work, and how maybe what they see would help better. What they see would help better. What they feel would be something that maybe they didn't have when they were growing up, when it was going on, and maybe that would be something that can help. Yeah. That would help them in that situation later, or if they had it, how that would have helped them. And then I think that the children, I keep saying that, I'm sorry, the young adults nowadays is just so strong-minded, and they kind of know what they want, and they recognize things, I think, more. I think in general there's less taboo, less of a stigma. I think that's because as a result of a lot of the awareness campaigns that are going on through the years. And so I think, like for me coming in and giving a presentation and a workshop at that level and expecting it to like kind of go up and they're going to teach that may not, but it's like, still, it's okay to talk about it. It's okay to look for help. So there is help now. I think from what I'm learning, that nowadays there's a lot more resources, a lot more services available. So that's definitely good. But yeah, and I think there are a lot of strong pillars in the community who are able to hold hands and pull people up. And so the combination of everything, I think, is working, helps the movement in a positive direction.
Yeah. And I emphasizing that what you're doing is creating awareness, and you brought up stigma as well, it's ending that stigma around just having these conversations and realizing what is DV and recognizing the signs of it. And even if the youth don't go and teach, what they learn, just having that exposure to, understand what is healthy versus not healthy, and knowing those signs is, I think, the most impactful thing that you can do at this point. And so you mentioned also that there is help and there are services. Do you want to go a little bit into the services you provide and the help that people can find?
Sure. So starting with our office, so Peace Between Partners, we provide advocacy. So that's kind of being your voice, holding hands and just walking you through the process. We provide court accompaniment. so I can go to court and just kind of be your support there. We provide transportation. I know a lot of victims and survivors who may be leaving a violent situation are leaving their breadwinner, leaving somebody who used to provide all the financial support. So we have a little bit of that in the office. We can provide the transportation, bus passes, some. If you are leaving, say for example, in the middle of the night, we can provide a safety bag that comes with personal hygiene products, some clothes, some vouchers to buy clothes, vouchers to buy food, some gas cards, just a little bit of help to like get somebody to the next step. We do have emergency shelter through our office, so we can provide a few days of shelter, reprieve, and then we can connect some victim to more permanent, more long-term services in the community. I could provide letters of support. Sometimes that's needed. For example, if kids are involved and you need to show that you've been attending, you've been receiving services from us, and that shows kind of like how you're picking up and making some progress and movement towards putting a life together. I can assist with housing. So just we don't have a housing. Permanent housing or long-term housing through our office, but I can be an advocate and provide support in looking for housing. So getting applications completed and submitted, finding out who does have housing programs out there, and then we also work with a lot of the local community service providers, like Strong-Hearted Native Women's Coalition. So they also have a shelter, and so we work with them to kind of see what's a good fit for our clients, and then working together and doing like a wraparound service provision along their journey. But yeah, and in addition to that, of course, outreach and, again, spreading the word and letting people know who don't know who we are, where we are, and what we do, and then providing the different trainings and presentations. So it's good to know where we're at and how to get a hold of us, especially like I'm thinking about like, because we're not the first kind of office that a person may have contact with, but they may see their nurse or their doctor more regularly. And so if those professionals know where we're at or what we provide, it helps that they are able to then share that information with their patients. And so try to do the outreach that way and let more people know in the community, professionally and in public, who we are.
Yeah. So you guys do provide a lot of services, a lot of very impactful, important services for people who reach out to you if they are in a situation. And I know with the prevention side, you guys also do. We already talked about the women's and youth and empowerment circles. We've talked about the self-defense class. What about the Clothesline Project that's coming up?
The Clothesline Project. So yes, another way of raising awareness. So in April, we did a Denim Day display in the medical lobby, and that was just to show support to sexual assault victims, and we displayed a bunch of denim jeans and denim clothing. So the Clothesline Project is actually it's a national project. It's another kind of display, an artistic display. It's a display of shirts on a clothesline, and victims, survivors, family, friends, supporters are invited to draw and create different sayings or displays of their thoughts and their opinions about domestic violence on the shirts. And so we'll put that up in the lobby. And then on the 21st, I'll be out there with a table, of course, with my brochures, and I'll be there to answer questions. But I'll also be there with blank shirts and some fabric markers so people can come by and draw a little bit, if you're artistic. Some of them are really like, it's just a way to like provide support, of course, and kind of just give an uplifting word. And saying a lot of them are really touching. Some people like to disclose, what what pain they've been through. It's just a way, as an artist, artistically, it's a way to express yourself. And so, but a lot of them are really supportive, just giving the survivor kind of that extra support. They're being believed, that there is hope, that there is light at the end, that it's not over, that doesn't define you. Very, very helpful words, because, you may go through that one incident or the two incidents or, a lifetime, but you got to get through each day still. And so those kind words, uplifting words do help. So that's why we do that. Yeah.
When we helped you with the Clothesline Project in April, it was April, right?
Yeah, the denim.
And it was the denim.
Yeah.
It was a really beautiful and creative way to get the word out and show awareness for people. And hopefully this podcast will be out by then, so we can get the word out about people coming and joining and seeing that. However, I'm sure there will be more in the future.
Oh, yes.
How can people reach you?
Okay, so my office number is 760-749-1410. I'm at extension 5326. 5326. So yeah, my office is located here at Indian Health Council. My email is jbautista, jbautista.
We'll put it on the screen.
at indianhealth.com. Yes, so click on the link below, which we'll call it. But yeah, I by phone or by email is fine. And of course, so my office, the Peace Between Partners program, is within the Tribal Family Services Department. Yes. So if you can't remember Peace Between Partners, you can't remember my name, contact Tribal Family Services, and then they'll get you in touch with me.
Is there anything else you wanted to cover? Anything we forgot about?
No, I offer a safe and confidential space to discuss what you need to discuss, maybe even to just get things off your chest. You don't necessarily have to come in and receive a product, a service, or, some people just have questions or want to know what else is out there. I'm definitely a resource. Call me. And even if you don't think that I could help, you just try me, and maybe I can direct you to another person who can provide more help. But definitely a place where want to provide a safe, comfortable place, and some people just want to come and just kind of take a deep breath and a pause from life and struggles and stress. Come by for that too, because we all need that.
Working with you for the last year, and I just want to get this out there, because if anybody's hesitant about reaching out, Jirrah is one of the most passionate people I've ever met in terms of helping the community with, she is a safe space, and you're so easy to talk to. And it's very obvious how much passion you have for helping people. And it's a calling for you, I can definitely tell. So for anybody who is worried about reaching out, she is a safe space. You are a safe space.
Thank you.
Yeah.
Thanks for having me.
Of course. Thank you so much for joining. I think what you do is so important, and I'm really glad that we were able to get your message out today.
Yeah, thanks.
Yeah, thank you guys for watching.